Many people with chronic and complex health conditions are at risk for hospital readmission, have less independence, and could benefit from better understanding of their disease and management options. St John of God Midland's Hospital Avoidance Response Team, known as HEART, provides early intervention strategies and case management for patients with chronic and complex health conditions. The multidisciplinary HEART team of clinical nurse, occupational therapist and senior social worker work across the hospital's departments to provide inpatient care and follow-up for patients, with better outcomes for patients being achieved.
HEART, which stands for the Hospital Avoidance Response Team, was instigated as one of our measures to manage the high demand on our services, as well as develop innovative solutions to respond to the challenges of chronic disease within the community. Hospitalisation for many chronic disease conditions are thought to be avoidable if preventative care and early disease management are applied, usually in the ambulatory setting. We are extremely grateful to East Metropolitan Health Service for initially funding the trial, as well as providing ongoing funding so it could become a permanent program for the Midland community.
We identified people that were presenting frequently to the department. We were finding that they were coming back sort of multiple times in a month and weren't being supported in the community necessarily, or didn't have the tools to access all of the different programs in the community. At Midland, there's been an increased demand for beds since we opened. So we looked at being innovative in ways to address those bed pressures in the emergency department.
We aim to engage patients who have ambulatory care sensitive conditions, so namely patients with cellulitis, who have UTIs, who have diabetes, cardiofailure and pulmonary disease. Patients who largely can be linked into services to better able to manage their conditions, ideally in the community, which would then prevent them from presenting at hospital. We would link those patients in with various community options, link those patients with outpatient services here, engage with the allied health teams, engage with the medical teams, and also engage in the patients' families.
A lot of the patients that we do see have struggled to manage their chronic conditions. A lot of the times their conditions are very complicated. They just need some help managing them.
I think what we do differently is we really put the patient at the centre. Everything that we do is patient focused.
We see them in emergency department, we see them on medical wards, we see them on the rehab wards, and we also do see them on the mental health wards. So I think that really that broad spectrum of we can see a patient wherever they need and to look at what's best for them.
We engage patients in the community. We would provide community follow-up calls post-discharge just to check in with patients to make sure that any services or any referrals made to external agencies have been met. Make sure that patient is generally okay upon discharge, whether they've linked in with the general practitioner.
I think our service has really strengthened community networks, particularly Silver Chains Respiratory Service.
It's certainly had a big impact on our patients who have a chronic disease and very complex needs. So these patients actually, they prefer to be managed in a community environment rather than come into a hospital. So the HEART programme works with us to try and encourage these patients to stay at home rather than be brought into hospital. And we look at all their needs to support each and every one of them.
Out of the patients we've had on the program, 85% haven't re-presented unnecessarily. It's decreased the length of stay for these patients in hospital.
Statistically, we've been able to keep more patients out of hospital. Anecdotally, from my patients, I've heard really good things.
They take the time to sit and listen to what's going on and provide advice. If that doesn't work, we explore different things. Having a constant person makes the difference, and they get to know who you are rather than having different people going through my life all over again. I have not encountered another project like HEART while presenting at other hospitals. I like getting calls from HEART caseworkers because it makes me feel that somebody is looking out for me.
Excellence for me would mean providing the best possible quality of care that we can to the patients that we work with. Each individual is different and trying to provide as best a wraparound service as we can.
Excellence is striving to be the best I can through education, through empathy, and through patient-centred care.